very lucky with this organization kasi we all have the different specialists. Okay, so we are very large number of experts. So with that, we are a voice to be heard. So with regards to the different national healthcare policies, I think we will be able to uh, uh, to I- uh, to indulge our health, our legislators to do healthcare policies that will benefit our patients as well.
I think currently we are in the front of doing this in shaping national healthcare policies by doing our advocacy, especially talking to our government officials in setting up policies like CPG guidelines, wherein this will be used to guide our fellow physicians. We can also engage other members to really prepare these guidelines to help with this. Likewise, with the national, we know that with regards to policies regarding internal medicines or this type of topics, the Philippine College of Physicians has always been one with the government in helping our government to help this. Likewise, providing good ethical physicians that will take care of our people during this time that we will have our universal health care. I think it's very important for us to continue educating our fellow physicians, especially with the Philippine College of Physicians, to really get engaged and really understand the universal health care, because as of now, this is the most important policy of the state that the Philippine College of Physicians is really helping, and it is helping in shaping these policies together with the local and national government.
I think PCP actually has a really large role and potentially a very significant role in shaping and guiding the future of our country in terms of healthcare. Being composed of a large membership and people who are, identified leaders in various parts of healthcare, we can actually be able to lead, we can guide, we can mobilize, and we can inspire public sector, public response, general people, lay people in general, through the many programs and activities that we have. So from PCP, we can help form policy by being part of technical working groups, for example. Individually and collectively, we can actually help form and guide how the direction of where certain programs will go to. Implementation will be a large segment of what we can do to support healthcare policies. And I think our mere presence and support for the programs, for example, of the Department of Health, will play a vital role of how we will succeed in the future, of how our country will succeed in the future and meet the challenges of public health.
Yeah, PCP should play a vital role in shaping national healthcare policies by advocating for evidence-based medical practice, as I mentioned, patient-centered and physician-friendly reforms. As PCP, we need to collaborate with the government agencies like the DOH, PHIC, Congress, to push for policies that would improve the healthcare delivery. We should also advocate for universal healthcare improvements, ensuring that internal medicine practitioners be properly integrated into the system. And then we support the legislation for enhancing the hospital funding to improve, also ensuring better facilities, equipment, and fair compensation for our internal medicine practitioners, especially those in the government hospitals. We can also help in shaping national healthcare policies regarding preventive healthcare and public health initiatives like nationwide awareness campaign on lifestyle diseases, prevention of diseases, promoting the program of the government like vaccination. But most especially, PCP must have a committee that will oversee any concerns of national health issues.
Sa palagay ko po, ang PCP should play a major part in shaping national healthcare policies. Dapat po pag nangailangan ng doktor, madalas naman, it's really a case of an internal medicine disease, no? Pag nangailangan po ng doktor, dapat ang hanapin nila doktor from Philippine College of Physicians. So I guess if I say that I would like PCP to play a major role in shaping national healthcare policies, dapat po sa atin magsimula yun eh. Kasi hindi naman tayo bibigyan ng role na ito kung hindi po natin i-improve yung Philippine College of Physicians. So as much as I would like us to play this major role, I would really pose this challenge to everyone, no? To really help so that PCP can achieve this stature na kailangan tayo po yung parang kinikilala bilang source of accurate, timely, and reliable medical information. Napakarami yung kasing fake news ngayon, no? So, hindi mo na alam kung totoo ba yung nakapost sa social media or not. So, gusto ko pag nangangailangan ng impormasyon, tawagan ng PCP, at PCP talaga yung kinikilala at pinagtitiwalaan when it comes to medical information.
So, our role as healthcare practitioners is to guide our national leaders regarding healthcare policies on the national level. But what I want to do really is for the local PCP members to actively participate in the local executive and community leaders' active role in their healthcare policies in their localities. What I really want is that because empowering them to be active in their local setting will mean responsibilities. If in doubt, we as PCP in the national will guide them on what they have to say, and we have to inform them that our answers should be scientific and evidence-based medicine. So we should create an atmosphere wherein we should help our local members be independent enough to be able to give guidance to our local executive and community leaders regarding healthcare issues in their local communities. I think it is best that we start from the grassroots levels going up. We have tried it with my committee in the Crisis Preparedness and Management Committee when we started it up from upstairs with DOH. Unfortunately, DOH wants us to start from the roots level. That is why, as of the moment, as National Chair for the Crisis Preparedness and Management Committee, we are starting to develop people to be advocates for the Crisis Preparedness Committee in the local setting.
We are already a very big organization, and I think we have been recognized by all the private and government sectors of the country. We have always been tapped as resource persons, as credible people that they are always asking for opinions. We are called key opinion leaders, Doctora. So I think we can continue collaborating with them, both the private and the government sectors, because I know that there's so much that still has to be done as far as development of guidelines, policies, healthcare policies for the country. and the promotion of these healthcare policies, and then delivery and implementation of these healthcare policies. So we will continue, as PCP, we will continue collaborating with the government, private sectors. We will continue talking to them. We will volunteer our services to them as credible sources of information, because we believe that we are a force to reckon with. As I mentioned, we are a huge organization, and the PMA even recognizes us in all of them. So we will continue with that, Dr.
So PCP should have an active role in shaping national healthcare policies. We need to engage other stakeholders for introducing national policies, and also we have to be very active in public health awareness campaigns.
Ma'am, I've been with PCP for the longest time, and I saw how it has evolved in being in shaping national healthcare policies. I think we have to continue to strengthen physician representation. We should continue to actively engage with lawmakers and policymakers to ensure that the voices of physicians are heard in shaping healthcare reforms. Before, physicians do not really engage in the national agenda for healthcare reforms. But now we see that PCP has been actively in the forefront of this. Also, we have to continue our public health campaigns so that all of the notions regarding diseases, we must lead initiatives addressing public health concerns such as non-communicable diseases, prevention, and access to quality health care. We should also be actively engaging the lay people so that they do not listen to other areas or other sources where they can get educated with their health. Also, we have to continue our partnership with government and national governmental organizations. So by collaborating with various sectors, we can push for better policies on physician welfare, patient care, and national healthcare systems. We also need to leverage the strength of our subspecialties, because if we are united in our stand in terms of healthcare reforms and healthcare issues, then we are a force to be reckoned with if we are united together.
We have been very conscious lately of the environmental effect of health, and I'm happy that I can see that in the initiative, especially in our local chapter, especially with the initiative here of the chairman of the environmental thing, Dr. Zonsa. We should maximize it. And at the same time, try to connect with other groups, especially NGOs who will help or who will communicate with us as far as the environmental thing is concerned. Public health is always our priority, but it is very challenging in the sense that we cannot do it alone. We need LGUs to cooperate with us. We need to connect to the people, to the community, in order for them to understand our initiative better. Most of the time, the reaction of the people can hinder the way we perceive things, and this initiative that we are doing is for their health. The communication aspect, I find it very challenging, but communication needs only that we share information, and therefore we have to maximize the way we communicate to share information with people. Media is there. We could maximize our communication with them, our cooperation with them. My initial advocacy, actually, when I started practice, was on TB, and in fact, I was the one who founded the coalition against TB in Region 6 in the name of SICA.
I think number one is that PCP should be participative in all the policy making of the government. PCP should be at the helm of healthcare discussion because, again, we are the leading organization with regard to healthcare issues. Number two is collaboration with the different stakeholders. DOH, PhilHealth, and other government organizations, and also the professional societies, so that all the professional societies, component societies, could push their advocacies and make it government policies or healthcare policies. And number three is promotion of primary prevention. Again, if we demonstrate to the government that prevention is key to decreasing cardiovascular health, to decrease, not necessarily cardiovascular because I'm a cardiologist, to decreasing the healthcare cost burden in the country, then it also will improve the national productivity of all our patients and members and the public nationwide.
If there's one thing which I think the PCP has really made very strongly a very good showing is that in the pandemic, we were able to show the government that we are a very strong group of physicians. Not only do we care for our countrymen who are sick, but we are capable of shaping policies. We are capable of producing guidelines. We are capable of really helping the healthcare system, not just in a medical way, but also in a holistic way, in that we look at healthcare not just in the form of medicines, diagnostics, but also what policies, what systematic changes should be done. And I'm very happy that our past presidents in the PCP have really led the way in making sure that our voice as PCP is heard by the government. We are able to influence policies and even the directions of the national government as far as health is concerned. And now that we have our strong connections with the Department of Health, I believe that our voice will really be much stronger. And by doing open communication, collaborating, not just with the local government, but also the non-government organizations, and strengthening our subspecialty societies, I believe that we can shape the guidelines, the policies in our nation, not just to improve health, but also to improve the economy of our country.
Actually, we are doing that already. Especially, I've realized that during the time of the pandemic, the government, the Department of Health, heavily collaborated with PCP in order for us to battle this pandemic. And after that, the PCP's role is being highlighted to become really the forefront of policy making, particularly in clinical practice, like what we are doing now. We are more of the clinical practice guidelines, not only in the formulation, but as well in the implementation. I think we have to really continue and strengthen that part of being a PCP member, to collaborate with agencies, with the government, with all the components of the healthcare system, in order for us to gain best medical care for our patients.
Since the Philippine College of Physicians, we are a very much empowered community. We have our leaders which are at the forefront of advocacies, at the forefront of developing policies. We have our past presidents. Then I would say that it should be part of our advocacy and mission as a college to make sure that we assist in the crafting of policies by coming up with all of the scientific evidence. Okay, so that's one part of it. Being doctors, we should be able to provide sound and evidence-based data because that countries do. They do not base their policies on hearsays or personal biases, but really research and evidence that is high quality should dictate our healthcare policies. Number two is being a college consists of different members coming from all walks of life, from the province up to the suburbs or the urban cities of Metro Manila. We have different subspecialties. Then we will be able to look and represent all of these various perspectives, and we should be able to consider all of this as we come up with draft policies, making sure that all of these health policies are able to address each of the specific concerns of the different walks of life. And not only should our role be very passive, but it's very advantageous for us to be proactive as well in pushing for our own agenda, if I may say, or pushing for our own advocacies as internists.
Philippine College of Physicians, I think, is doing a good job in playing a role in national healthcare policies. We should have a voice in the government so that we could be able to tell them the problems facing our PCP membership, not only our PCP membership, but also the patients that we take care of. So by having a voice in the government, then we will be able to take part in forming policies for our government that can be beneficial to our members and also to the community.
Professional organization of internists, PCP is well positioned to contribute to the development, implementation, and evaluation of healthcare policies. It should be proactive and act as an influential partner in shaping national healthcare policies by leveraging its expertise, networks, and commitment to improving health outcomes. PCP can help ensure that the healthcare policies in the Philippines are effective, equitable, and responsible to the needs of the population. And here are some key roles of the PCP should play: for advocacy, in evidence-based policies, expert consultation and technical advice, also in capacity building and education. This is for training and development of future healthcare leaders. Collaboration with DOH and other medical societies in specific health issues such as the universal healthcare, non-communicable disease, and emerging infectious disease. Monitoring and evaluation of national health programs is also one of the role of PCP. And in ethical and patient-centered care, we should ensure as an organization respect patients' rights, promote equity, and address disparities. And in public health initiatives that addresses the social determinants of health. Also, we can do research and innovation that can promote adoption of new technologies and practices that improve patient care and health system efficiency. Crisis response and preparedness, especially during pandemic and disease outbreaks. PCP may also suggest solutions to overcome barriers in dissemination and implementation of national health care programs.
PCP has been very good in terms of, well, my perfect example is when we were able to be a prime mover of the syntax. I think we can do more. Our frustration in the College of Endocrinology is that there was a program before in terms of nutrition wherein we really can put the calories in the different fast food chains, just like in the other countries. We were there, especially with the sweetened beverages, putting tax on that. However, in terms of other programs that should have been there, like nutrition, how we can further improve this increasing trend of obesity and overweight, it fizzles out. I don't know what happens, but usually it fizzles out. But I think we should be a prime mover in these healthcare policies. I became frustrated because there are certain UHC policies wherein we were not consulted that much. I in talks with them, I asked them how come these were what you think. Just an example for diabetes, they really thought that treating diabetes is just give medication, one medication, and then after 3 months, you give another medication. And I've been explaining to these people that it's not how we treat diabetes. It's more of treating them individually. So PCP is a very strong, it's a very strong college, and we should have someone there always to be part of the Congress meeting, putting out bills, and we should always be aligned to them. No, so something I'm quite somehow frustrated that we were not always asked. Wherein it should be the one we should always be asked.
Straight from the heart, PCP's role is more than setting standards in internal medicine. It has become the driving force for real change in our healthcare system. Our collective voice can reshape the future of national healthcare through the following. Number one, stronger voice in healthcare policies. We must actively engage with lawmakers and government agencies to advocate for sustainable healthcare funding, proper field health reforms and accountability, and also equitable access to healthcare, quality healthcare. And second, by championing physician rights and welfare, PCP should lead in fighting for better pay, benefits, and working conditions for all doctors, ensuring that healthcare professionals are valued. And thirdly, expanding community health initiatives by strengthening PCP's community outreach and preventive health programs, and make sure we are not just leaders or healers in hospitals, but we are also advocates in our societies. Because I believe our country, not just the citizens, also require our healing touch and malasakit every once in a while. Our voice matters in nation building and preservation of human rights, not in spite of, but because we are doctors. We are the poets of existence, champions of our creator. We should hand in hand occupy the streets if necessary to bury injustice and push for accountability to the max. As Filipino physicians, let us continue to curse the darkness by lighting a candle to brighten the lives of others.
Okay, that's a very big role, Doc, no? If you come to think of it, converting into healthcare policies. But we can really do this. We can make this through beginning with small-scale changes, meaning in schools, in cities, in towns, in the provinces. So first is involvement with the LGU, and the only penetration that we can do towards involvement with the LGU is through the chapters, Doc. Chapters should work hand in hand with the LGU, and we've seen this during the pandemic, the chapters working together with the LGU. We should magnify our advocacies. If we need to submit signature campaigns, we must do that. Let's encourage PCP member netizens who are very active in social media to promote factual information, because surely this will pull the trigger of healthcare policies. Second is we must go after DepEd. And our hero program, for me, we have to print the advocacies in school textbooks. That's a very good jump from just talking about it into studying about it. And third and lastly, Doc, and this may sound quite an ambition, we should have a representation in the Congress.
PCP right now is very active in collaboration with the PMA and the DOH and other agencies in the government in shaping the healthcare policies. I think we should go back to policy advocacy to continuously collaborate with the government agencies to influence evidence-based healthcare policies. and also to provide expert consultation, to give our medical expertise in legislative discussion, to ensure patient-centered and physician-friendly laws, and of course, public health leadership to continuously lead in initiatives on disease prevention, healthcare equity, and of course, system improvement for national health well-being.